As we seek to help you rebound from this ongoing pandemic, we're checking in with area CEOs to see how they're staying afloat and helping you stay afloat as well. It's an interview you will not see anywhere else. We go one-on-one with the CEO of one of the Metro's largest healthcare providers, all to see how they're keeping workers both safe and employed.
This is the first time I've worn a tie, Kevin, in 3 months. I did it for you, bud.
Even those tasked with helping and healing can also be in need of helping and healing.
Person, the husband, the family man, the resident who lives in the metro area, how you doing?
You know, I'm struggling a bit, to be really honest with you. Hey.
Raise your hand if you can relate to that, right? Bob Page.
I'm 62 years old. My life has totally changed.
Is CEO of the University of Kansas Health System. He hasn't seen his adult children in months due to this pandemic. He just had cancer surgery in April, and he's among the top execs operating on the budget of one of the Metro's largest healthcare systems.
Year to date, how you guys doing in terms of finances?
We were forecasting the best fiscal year we've had in a long time. We're going to be substantially less. We're going to be about 80% of what we were on target to do. We lost money in March. We lost money in April.
First time in over 20 years, the hospital lost money in back-to-back months. However, the hospital still finished the fiscal year in the black.
There's two groups out there, Kevin, during this time. There's the people that are just going to try to hunker down and survive. And then there's the other people that are going to try to take full advantage of a crisis, if you will. And I don't mean that badly, but to really take on a leadership position and prove to people this is the place you want to be. And that's the path that we're going down.
That path has had several twists and turns amid this COVID-19 pandemic. U.S. hospitals expected to lose around $200 billion between March 1st and June 30th. Money that usually comes from things like elective procedures.
You guys make so much money over electives, elective surgeries, other procedures, and those procedures were kind of put on pause during this pandemic. How do you ensure job security for your employees?
You know, Kevin, this will be kind of our answer for this, simply because for the last 21 years, we've had a formula in place here. And really the formula was if we provide world-class service with the best outcomes possible by the right team of people, we'll be fine from a growth and a financial stability standpoint.
Page says that formula has kept the current staff at 12,500.
What do you think your business will look like in 6 months? What's the business model for the University of Kansas Health System?
Telehealth is a whole new piece for us, Kevin. Last year, I think we did 1,000 telehealth visits. Today, since March, we've done over 65,000 telehealth visits. We've got this map that actually looks like a kid that's got chickenpox, but it's all the red dots across the state of Kansas, Missouri, Nebraska, Oklahoma, where our new patients we've seen through telehealth. And it is phenomenal to see that reach, and I think that will be a big change in our business.
Page says the biggest thing they want everyone to know, saving lives is a much bigger priority than saving money. So of the more than 12,000 employees, Page says about 2,200 are working from home. The hospital in the process of bringing some of those workers back, especially those working in clinical support, if it's safe to do so.